Thank you so much. So I will present an overview what were key outcomes and key events at the International AIDS Conference in Munich. It was in July this year. So just very quickly, I would like to inform that there were over 10,000 participants at the conference with 864 scholarship awarded. So please don't ignore this opportunity. It is a way to obtain scholarship, especially for young scientists and researchers. Keep it in mind for the next conferences. Based on the survey, we received very good outcomes in regard to the program structure, speakers, and knowledge acquired with over 90% positive feedback. And it was a huge media coverage with 656 articles and media reports. It's 2 times larger than during the previous conference. So it's an indication of the scientific outcomes there and interest from the general public too. And to bring your attention that conference materials, some translated into Russian and other languages as well, are available on IAS Plus. So please keep it in mind. I would like just to share my personal highlights of the conference with 3 issues. One is the slogan of the conference, "Put people first," which means as my colleague said, focus on the communities, on the most vulnerable, on those left behind. Resources might be bigger or larger, but without focusing on the most vulnerable people, we cannot stop AIDS. And another thing, we are dealing not with infections, but with people. And people have multiple problems, including co-infections, comorbidities, but also issues like mental health or cardiovascular diseases. So it's getting more and more on the agenda that we have to deal with people holistically, not with one disease. Second highlight, conference was in Germany, but the emphasis was on our region, Eastern Europe and Central Asia. It was impacted the program. We had a plenary speaker from Ukraine and from Poland. Ruslan Paverga from Initiativa Positiva spoke at the co-chair session on presenting Moldovan experience of working with key populations, applying technology, vending machines and other. There was a big attention for the region because in our region, unfortunately, epidemic is going up. In Africa, it's going down. In most of the Asian countries as well. So that's a big emphasis. And my final point here about new medication, lenacapavir. It's seen by scientific community at the conference as a game changer. This is IRV, which is used also for PrEP, pre-exposure prophylaxis, with the injection twice a year. So it's a new kind of IRV, which considered to be key technological and scientific finding on the way to 2030 goals. Now moving to a more formal overview presented in this toolkit. I'll go through the slides very quickly. My role is just to maybe introduce them because there are a huge number of slides. The full version is available on the IAS website, IAS Plus. The structure of the update is the first section on remission, cure, and vaccine. Next on IRVs, then HIV, STI prevention, including PrEP, gap, access, and resources, improving HIV care, structural factors and determinants of health, criminalization, discrimination, and stigma. So in terms of cure, there was a progress with several people to be cured, I think 7, using stem cell transplants. So 3 of them were physically present at the conference. So it was an opportunity also to see these are real people cured. And it created a lot of optimism, because there were several also studies presented there, including cure approaches among children. And in terms of vaccines, there are less progress, unfortunately, with vaccine development. Everyone was encouraged how quickly vaccine was developed for COVID-19, but unfortunately for HIV, well, there is still optimism, but we didn't move much forward as 10 years ago, unfortunately. In regard to IRVs, combination of cabotegravir and rilpivirine for adolescents were in focus, but also linkage of abacavir and cardiovascular health. So injectable cabotegravir plus rilpivirine was in the focus of the study in several countries, showing very good outcomes, but we hear from those using cabotegravir about injection site reactions. So I specifically put this slide because it focuses on this, that 34 had injection site reactions. Nevertheless, 100% of participants preferred the long-acting injectable regime over oral IRT. So it's overall the health response is actually quite positive. Another thing, as I mentioned at the beginning, about holistic approach to the person is linkage of abacavir and cardiovascular health. And some studies are linking linked recent and cumulative use of abacavir with cardiovascular diseases. But it remains a preferred regime in some guidelines. Another conclusion that cardiovascular events were not associated with exposure to other selected antiretrovirals, as described on the slide. Weight gain was another focus at this section, in particular looking at combinations Dovato and Biktarvy. And with the Biktarvy, there is a link, actually, a study show to additional weight gain. In regard to long-acting PrEP, lenacapavir, it was a very strong study outcomes showing great results of using lenacapavir for PrEP, pre-exposure prophylaxis, both among women, young women, 16 to 25 in South Africa and Uganda, and men having sex with men. As lenacapavir reduced HIV incidence by 100% as compared with the background HIV incidence. So it's a very, very significant breakthrough of the effectiveness of this medication. it was also another study focusing on using long-acting lenacapavir for women with pregnancies. But as a result, principal investigator Linda Gale Becker, who was a former president of IAS, who led the research, describes these results as beyond wonderful. So I don't remember any such high, inspirational conclusion at previous conferences. So even when cabotegravir researchers were known, so it's really seen as a game changer medication, as I described. Well, there were some specific also emphasis on approach to HIV testing for people taking cabotegravir. Again, details are at the IS website. And doxy PrEP, or using of doxycycline post-exposure prophylaxis, but also PrEP, pre-exposure prophylaxis, especially for gay and bisexual men, was also at the focus of the study, showing its effectiveness for substantial reduction in incidence of syphilis, minus 79%, and chlamydia, minus 92%, and gonorrhea, minus 68%, with the doxy PrEP arm. Another study was done in Japan, also with providing a lot of evidences of effectiveness of doxy PrEP in reduction of STIs. In terms of gaps, access and resources, big kind of push was made at the beginning of the conference by Executive Director of UNAIDS, Winnie Beniamina. She actually presented cost of inaction. What will happen if we will continue business as usual with the current level of spendings? And just to remind that in terms of key populations, for example, UNAIDS target is 20%. 20% of funds should go for key populations. Now it's only 2.6%, nearly 10 times less of HIV spendings for interventions for key populations. But in terms of reaching 95 target, we have two scenarios with the business as usual delaying actually reaching the target to 2050, and optimistic scenario is fulfilling the target. But the cost, human cost first of all, are so dramatic. So with the continuing business as usual, we will have 34.9 million new new HIV acquisitions, and 17.7 million AIDS-related deaths between now and 2050. So it was a call for action in regard to HIV spendings, increasing domestic funding, focus on key populations, but also call for pharmaceutical companies, in addition to scientific innovation, develop a model for access. In particular, she also called to Gilead Science to make lenacapavir, this game-changing medication, available. And actually there is a progress. I think most of the countries of our region, Eastern Europe and Central Asia, including Moldova, are now, this is post-conference announcement, available for generic version of lenacapavir, which will roll out in several years. It's not immediate outcome. There was also another study presented there on pediatric coverage, which is low, as well as low adherence for HIV cascade among children in comparison with adults. In terms of political leadership, the slides presents experience from African countries, but we know how important it is in our region, and unfortunately, we see some sliding back in terms of repressive and restrictive legislation, like anti-LGBT law in Georgia and in Kyrgyzstan approved this in last year, or some other policy restrictions. So it's so critical for all actors to unite efforts to oppose these dangerous trends, not only in African continent, like in countries like Uganda, where it is also very, very restrictive and repressive, but to in our context as well. NCDs was given as an example for need for integrated health services, and there was a presentation related to one-stop shop, but not only for HIV services or HIV and tuberculosis or drug use, but also related to NCDs, widening this service menu, including this as well. Mental health, healthcare also is seen as an essential element for holistic approach in addition to just HIV services. In regard to structural factors, it was also big focus on impact of the conflicts and wars, as we have in my country, Ukraine, with Russian full-scale war against us. But more broadly, also issue of other countries like Sudan or situation in Gaza was also brought to attention. How modify services to address mobile population and migrants and refugees. So in this regard, again, emphasis on tailored services and holistic services were presented. There was also a presentation on opioid agonist treatment using methadone and buprenorphine in Ukraine, highlighting that modification of regulations, including offering take-home dosage for 30 days, which is very unique, and we never had it in Ukraine. It was 10 days maximum. To 30 days gave opportunity to continue uninterrupted treatment for people receiving opioid substitution therapy. Next slide is focusing on criminalization, discrimination, and stigma. Again, it was a big concern of the growing trend. So it's not a decreasing but growing trend with anti-LGBT law in African continents, but our region, as I said, is not an exception as well. And it's so critical to oppose this trend, which is ideology-based, not a science-based. There was a study on stigma among healthcare workers, and unfortunately, it was a multi-country study with, I think, 54 countries across Europe and Central Asia. And unfortunately, level of prejudice or stigma is very high, like kind of more than half of healthcare workers afraid or worried drawing blood from a person living with HIV. So personally, I was shocked with these figures, how high they are, as well as some taking 2 pairs of gloves. So it's like 25, 30 years ago. But unfortunately, this is a signal how important to do information work and education to overcome this kind of old style and ungrounded prejudice. So that's it. Again, I apologize, I ran quickly through the slide, but full version is available on the website. Thank you very much.